This is Dr. Robert Marvin from Houston, and we're visiting with our patient, Rinda. She had an endoscopic revision of a lap band almost 3 months ago. So how long ago was your original surgery for your lap band?
10 years ago in 2007.
Okay. And how much did you weigh before you had that operation?
I was around 280.
Okay. So with your height, that's a body mass index of about 46, 47. Did you have any other medical problems related to your weight at that time?
Hypertension.
Okay. Were you on medication for that?
Yes.
How many?
Just one.
Just one medication? Okay. And what about high cholesterol, triglycerides, that kind of thing?
Yes.
Okay. So those are both comorbidities related to your weight. So that's a very reasonable, you meet the criteria for weight loss surgery, which means that a lap band was a reasonable choice at that point. So how much weight did you lose with the lap band?
The lowest I recall was around 190.
Okay. So
So
90 pounds. So that puts you at a body mass index 31, 32. Much healthier body mass index. Did your high blood pressure get better?
I stayed on that medication. They didn't remove me from it, so I think it had improved, but I still needed to.
Okay, you're still
remain
taking.
on.
All right. Do you know about your cholesterol and your triglycerides?
I never
Didn't have them checked?
don't recall.
Okay, all right. So how soon after the lap band surgery did you get down to 190 pounds?
It was a couple years.
Okay.
Year and a half.
And
2.
adjustments, how many adjustments did you have?
I started out slowly because I did not live in the area where I had this procedure done.
Okay.
And I had to travel out of town
Okay.
to have my fills. So I started out slowly, but I know I had at least 10 fills over a long course.
Okay.
10 to 15.
So that's more than average number of adjustments of a lap
Well,
band.
I also I had a slip, so I'm probably factoring in
Okay.
going back, and because we've had to start over.
So a slip is a prolapse. That's where the lap band slides down the stomach a little bit, or conversely think of it as the part of the stomach wall sliding up over the band. That changes the angle of the band, and sometimes that produces obstructive symptoms, but it also increases the size of the little pouch above the band, can make it a little bit harder to lose weight. So how was the slip treated?
I had to have a procedure done too.
Surgery. Okay, laparoscopic procedure. And what did they do? Put the band back in the correct position?
Yes.
Okay. Did they change the band for a different kind?
No.
Okay. All right. So were you having trouble with vomiting and that kind of thing
I did
during
not-
those adjustment phase?
Oh no. The reason it slipped was from vomiting. I got sick, and that's the reason it slipped. But it's from that, I never had any.
Okay, so when you were at around 190 pounds, what could you eat?
It was important to chew my food up very well, and it was important not to drink liquids. But I was getting little, and I could get some protein, but I was having to drink.
So were you eating mostly solid food, or was it soft food, or liquids? Or?
I was eating solid food.
Okay, all right.
But I was.
And how often were you throwing up?
Well, in terms of throwing up, you mean I would get what I call plugged. I don't know if that's the term for it. Plugged.
Right.
And I couldn't swallow my saliva, and that would come back up.
So
I never had food come back up, but I would have saliva or liquid come back up.
did that happen more than once or twice?
It would pretty much happen maybe almost every time I ate.
Okay. So
If that's what you're referring to as throwing up,
yes.
then that's that. Okay.
Yeah, that hard pressure feeling, and then nausea or vomiting with it. So after the lap band was repositioned, sort of what was the course after that?
I started having fills again. went back for an initial fill and a follow-up fill, but I think I was more nervous about the plugging that I was getting almost every time I ate, and the slipping that happened, that I didn't continue with the fills, and I was more nervous with all of that.
Okay. So understandable. You don't want that to happen again and have another surgery.
Exactly.
So did you slowly gain weight from that point going forward?
Because I stopped going in for my fills.
So when you came to see us, what was your weight at that point?
250, 240, 40, 50, somewhere in there. I
think it was 257.
Was it? Okay.
Yeah. All right.
Oh.
So yeah, so this is not an unusual scenario for a lap band patient. Typically, they will lose a considerable amount of weight at the beginning. So she went from 280 down to 190. That's a good amount of weight loss, significant. Sometimes the comorbidities will be gone after that, which is great. The problem with lap bands is trying to maintain that, and a lot of times patients, their system or the physiology won't tolerate the tightness required to get down to that level, and they have to be loosened, or something happens like a prolapse, say, and then once the adjustments are made to deal with the symptoms, the negative symptoms, or the problem, the patient starts to gain the weight back. And so at 257, your body mass index is over 40 again. And when we saw you, you had high blood pressure and high cholesterol and high triglycerides. So you were sort of right back in the the zone of morbid obesity, where a surgical option would have been an option at that, where surgery would have been an option at that point. So a lot of patients in our practice have gone from a lap band to a laparoscopic sleeve at that point. But we talked about that. And switching over to the sleeve has some risk attached to it. And in our practice, our experience is that the risk of leak is somewhat higher with a revision to a laparoscopic sleeve from a band than for a first-time laparoscopic sleeve. And I remember talking to you about that, and you didn't really feel very comfortable about that.
Right.
So we took the fluid out of your band, I think, when we saw you at that point.
We did.
And then you picked the other option, which is endoscopic revision of your lap band. So tell me, right after that procedure, sort of what were you feeling that first week or so?
The first week, I was strictly on liquids. I had some soreness in my throat from the procedure, which I was told to be expected.
Right.
Other than that, I didn't have any pain or anything like that.
Okay.
I just took it easy, and I did call you within that first week, because I had thrown up some blood, but that was from the procedure, that had settled in my stomach.
Okay.
I didn't pass it. It ended up.
And that was a one-time only thing?
It was a one-time thing.
So other than that episode, that single episode of vomiting, did you have nausea the rest of that first week? You were able to tolerate the liquids? Okay, good. Were you able to get back to some of your normal daily activities pretty quickly?
I was.
All right, good. What about work?
I don't.
All right.
I have kids.
So we'll strike that. All right. So you're able to get back to your normal daily activities, taking care of the kids and everything around the house?
That's right. Yeah.
Okay, very good. So since then, you've had a diet progression. How's that gone?
It's gone well. I have noticed I was a big sweet tooth person.
Okay.
And I have noticed that's changed. I don't know if the word is crave, but it's like, because that has been such a big part of my life, my brain knows that I like it, or at least I think I like it.
Imprinted habit, right?
Yes, and I've tried it. I've gone to eat something, and I'm like, it doesn't taste the same to me.
Okay.
I don't have that, because I'm like, I know I like this, but it's different. I
So,
don't know how to explain that.
did you have any of that sort of feeling when you had the lap band? Okay. So there are some intestinal hormones. The best understood hormone would be ghrelin. But we know that with the laparoscopic surgery, there are changes in those hormones, and that patients commonly say what you just said, that their cravings change, their taste changes, and their desire for those things that they were really in love with before has kind of gone away. So that's very helpful for overall weight loss. So, and there is some evidence that patient or the endoscopic procedure does decrease or change the intestinal hormones some. So we're hoping that patients like Rinda will have the same sort of effect, which is decreases the drive to eat, and it's very helpful with the weight loss. So what are you eating now? What's a typical meal for you?
I'm trying to stay what I'm calling lean and clean.
Okay.
With just fish and chicken.
Okay.
I'm trying to stay away from pastas and rice.
Okay.
Things like that. There have been occasions I have, had it, but it's not in my normal diet regimen now.
It's fresh fruits and vegetables?
Yes.
Okay.
Yeah.
So are you tolerating all that pretty well?
I am.
Do you have any plugging or any sensation like you had with the lap band?
No, but I do notice a stopping point. I feel it's a lot lower than what it used to be.
Okay.
I can tell. I'll fill up my plate. What I used to have, well, of course, in the beginning, I'm getting adjusted to it now.
Right.
But in the beginning, I'd fill my plate knowing this is what I used to eat, and only eat a small portion of that and feeling full.
Right.
And so I've adjusted that to my portion sizes now.
Right. So with this kind of procedure, the idea of a portion is probably not the greatest thing. So instead, we prefer the patients to eat slowly, small bites, chew well, take their time, and when they start to feel the pressure sensation or there are other cues that they're getting full, they need to stop. So whatever food's left on the plate, they shouldn't be eating it. So it should go back in the Tupperware or the fridge or wherever. Okay, good. So how much weight have you lost?
22.
22 pounds. Okay. Yeah. Right. So that's around 8% of total body weight, which is sort of what we'd expect if this was a straight endoscopic sleeve gastroplasty. The difference is she still has a lap band. So today we're going to see if we can adjust her lap band a little bit to maybe give us some help with her weight loss. So we're not going to try to make it as tight as it was before. So today we're going to adjust her lap band and see if we can make it a little bit tighter to give us some extra help with her weight loss. We don't intend to make it as tight as it was before, and we probably shouldn't need to make it as tight as it was before. So we don't want to get to the point where Rinda feels she's plugged or has nausea or any problems like that. We still want her just to feel full with a small amount of food.
Okay.
All right.
Good.
Are you? Would you say you're happy with your results so far?
Yes.
Okay. So another lap band patient that's sort of been through the same thing, maybe where they've had some success and then had some backtracking or had a prolapse and a procedure. What would you tell them with regards to the endoscopic suturing?
Well, for me, I know it was the best choice because my own issues with what I was having with the band, I was not able to stay successful with it. So if they know that they can't stay successful with the band, then this is an excellent option.
Okay. And really, the band anatomically, the lap band, and the suturing that we do in the stomach are two separate areas. So we don't have to reoperate or adjust anything or create extra risk by removing the band or moving the band. So it really is a nice fit, sort of putting two procedures together to see what we can get after that. So, all right.
Okay.
All right. Nice to see you.